Thank you, panelists, for joining us, and to our viewers who are watching online live. My name is Shannon Handy. I am a reporter for CBS 8, and I do a franchise called The Learning Curve, which we started back in the beginning of the pandemic to really focus on schools and how this pandemic was impacting students. And I know there has been a lot that has changed since our last panel back in October. That's when I first got in contact with the Cajon Valley Union School District and met David. And from there, we've been doing stories together to really just educate parents and students as well. So thank you all for joining us. We have a great panel tonight, and I really hope to help a lot of families and a lot of students who might be watching. And with that, I will pass it over to David. He is the superintendent of the Cajon Valley Union School District. Hi, David.
Hi, thanks, Shannon, and thank you, News 8, for hosting this. When we shut down March 13th, 2020, we were asked to do three things: provide distance learning, provide continued meal support for our students, and provide free childcare for essential workers if you can. And in April 2020, we asked our parents, if we provided free childcare for essential workers, would you use it? And the response was overwhelming. And Pauline Lucatero, Director of Nursing, who you'll hear from in a little bit, answered the call and helped us to set up our first emergency childcare, which we turned into basically school and served our community throughout the entire pandemic. Thanks to Health Centers of San Diego. And I'm excited to introduce our Chief Medical Officer, Dr. Chris Gordon, who will share some lessons learned since October, when we last engaged, and what we need to know about school and safety now. Dr. Gordon?
Sure. Hi, everybody. Welcome. I'm Chris Gordon. I am the Chief Medical Officer of Family Health Centers. I've been with the organization since 2009. I am a family physician by training. It's been an interesting experience, obviously, running an organization, especially a healthcare organization, through a pandemic, something that many of us have never seen in our times. We've had to rapidly adjust to new information as it comes out, obviously with an emphasis on ensuring the safety of our patients and our healthcare workers as well. And so I'm excited to be able to be a part of this forum and talk about education in school and sort of what that looks like in the school system. What I can tell you is we've had to keep an open mind in receiving the information, reviewing the information. There's lots of bodies that make policy. So the Centers for Disease Control is one example, and then for business, OSHA is another. And so we're trying to make sure that they're providing guidance for us as a healthcare agency, making sure that we're following that guidance and ensuring that our patients and our staff are educated on the risks with this virus and what we can do to protect ourselves. And so thank you for inviting me. I'm happy to be here.
Thank you so much, Dr. Gordon. We love having the Family Health Centers of San Diego involved in this. You guys are the experts, so we're happy to have you. And we will be answering a lot of parents' questions, so stay tuned for that. And with that, Dr. Christian Ramers, he is the Chief of Population Health and Infection Control Specialist for the Family Health Centers. And I'm sure you could ask this a lot. What do we know about COVID-19 today? We've been at this for 14 months now. So what do you tell people when you get that question?
Thank you, Shannon. It's not an easy question to answer in just a couple of minutes, but I'll do my best here. It's been a year of incredibly fast learning about this virus since it first hit our shores really in February of last year is when the first cases were recorded in San Diego. We've learned a lot about transmission. So we know now that the majority of transmission that's occurring is either from droplets that, when you talk and when you sing, or even when you breathe, within about 3 to 6 feet around you, there's droplets that contain the virus that you can infect people around you, but also from aerosols that can go a little bit further in the air. It looks like that's a probable way that transmission occurs. And in the very beginning, everyone was so paranoid about surfaces and bleaching everything and bleaching our groceries. And it looks like that's probably not a real major way of transmission. The CDC estimated only 1 out of every 10,000 infections is caused by that. So we can put the bleach away for the most part. Still a good idea to wash your hands, but it looks like mostly through breathing. This is a respiratory virus. One of the interesting things we've learned is timing is really different for this virus. So there's an incubation period of about 14 days. What that means is you could be exposed today and not get sick until 2 weeks from now. And that's one of the secret weapons of this virus, is that it can sort of hide amongst people and make people very sick based on exposure 2 weeks ago. And that explains why we have our quarantining rules and our isolation rules, because people can actually pass the virus before they even get sick. And many people don't even get sick at all. There's about 40% of people or 30% that are asymptomatic through this. The manifestations of the virus are incredibly variable from there on forward. Some people just have a cold and they sort of get better. And then some people get incredibly sick and need to go into the hospital during the second week of illness. And then, of course, many people actually die from the illness once their body gets overwhelmed with the inflammatory response. We have learned a tremendous amount about treatment. So there's actually now a treatment that we're administering at family health centers that's available. If you give it early enough, it can actually save that whole second part of the illness and save people's lives. And we've been doing this in the Hillcrest area and in Chula Vista. I've given it's called a monoclonal antibody infusion. We've given it to over 250 people now, and have had only 2 that had to go to the hospital, which is really an incredible reduction in the burden of disease. A question a lot of people have, which I'm sure is relevant to all the parents, is, does this affect kids? Early on, people said, oh, it's just the sniffles, it's just the cold. Do we have to worry about it? And the answer to that is that it does affect kids, much, much less than adults, but it actually does affect kids at a small percentage. So I pulled some numbers. There have been almost 4 million cases of COVID in children less than age 18 in the United States. 15,000 kids have gotten sick enough to be in the hospital, and 306 kids have died in the US of COVID. So that's a small percentage of the number of adults that have been sick and have died, but we can't really say that this is completely benign in kids. To break that down, in California, there have been 21 children in California that have died of COVID, and 2 of them right here in San Diego. There's also a lot of things that we don't know still. There's some very mysterious parts of this virus. There's something called long COVID, where people that recover from COVID still have symptoms for many, many months. We don't quite understand what that is. And then one thing particularly relevant to children is this multi-system inflammatory syndrome, where after the COVID is gone, in some kids, the body, the immune system just gets really out of control and can make kids very, very sick. And there have been almost 4,000 cases of that syndrome in kids, and 35 kids have died of it. Now, epidemiologically in the US, because of some of the things we've done, and I'd say mostly because of vaccines, the numbers are declining a lot. We're in really good shape in San Diego. California, in fact, has the lowest case rate in the nation of any other state per population. So we're in really good shape, and that's mainly because more than half of our population has been vaccinated. So that's really one of the messages. Lots of questions I know are going to come in about masks and are they necessary? And today has been a very big news day about masks and whether we're going to need to keep wearing them. And I'm sure we can get to it in the Q&A section, but the CDC finally has said that for people that are fully vaccinated, and that's mostly adults at this point, that masks are really not as necessary anymore because they're so protected from the vaccine. Lots of caveats to that. You're still going to have to wear a mask in the hospital or at a doctor's office, on an airplane or on a train. And then businesses ultimately have the final say of whether you have to wear a mask to go into their establishment. And of course, California has said that we're going to wait until June 16th. So local and state rules still apply. I'm going to finish just with vaccines. It looks like we might have lost Shannon, but I'm sure she'll be back. I'm going to finish with vaccines. Today was also a very, very big day because it was the first day that 12-year-olds through to age 15 were eligible for receiving the Pfizer vaccine. And lots of people think that the vaccine got approved way too quickly and that it was rushed and that there may be some harm that can happen from it. I'm here to say that the processes that we normally use to approve a vaccine, all of those processes were used in the exact same way. Phase 1 trials, phase 2 trials, phase 3 trials in thousands of people. The FDA rigorous review of the data in a very transparent way, the CDC weighing in on that. And so these vaccines are incredibly safe, and they're doing very, very good surveillance to pick out any rare side effects that we just haven't really seen much of. I was going to show you a slide deck of a very momentous day for me. I took my 13-year-old daughter actually to get her first Pfizer vaccine today, which means that, well, in a couple of weeks, I can say that my entire family is protected now from getting COVID. The last thing I'll say about vaccines is many people wonder what's in them. These are mRNA vaccines, and so they have just a tiny little piece of mRNA, which is the the message that actually makes your body make a protein. That's the basis of the vaccine. It's covered in some lipids or some fat molecules, and then there's just some salts and sugars, and that's basically it. There are no microchips. There's no heavy metals. There are no preservatives even in these vaccines. And then the side effects really, sore arm is the most likely thing you're going to have, maybe some light fever or chills for a day or two. No effects on fertility, none of that kind of stuff. We've really seen none of those safety signals. So I think I'll stop there. And I don't think we have Shannon with us, but maybe David could take over and
She's going to try to get back on. Thank you, Dr. Ramers. I'm going to ask you to come back later to talk more about your daughter's experience and really go slowly for our parents in terms of what actually happens when a vaccine enters our body, and for our parents' children's bodies who are not sure they're going to have their children get vaccinated yet. And with that, I'd like to introduce Dr. Kuala Suleiman Kafidi, Chief of Pediatrics.
Hello. So I wanted to talk about the impact of this whole pandemic on children and what we are seeing in our clinics and also what we've seen in the community. So as you've seen the impact on children and families, you know, the economic impact, the loss of jobs, the job insecurity, the social isolation that the children have experienced with its impact on how they feel at all levels. We've seen children who come with sleep problems being young and also with eating issues. We have kids who come sad and depressed in the office and feeling anxious, and especially also with the impact on the education, you know, how where the children have, you know, with the school closures initially and some of the schools that have been closed and with the distance learning, this really had caused a big impact on families, and especially families who some of them are not very with not a good level of education, or even coming from different cultures where English is a second language, or some of those you know, families where there's multiple children in one room to educate and to learn the technology. You know, people coming from different cultures, as well even people who are working, trying to make a living for their children. At the same time, they have to be the teachers for their children. This had been really very, very stressful, and we see that we've seen this impact of toxic stress on children and on families, with the depression, with the anxiety, of course, with the lack of sports. So not only it impacted the mental well-being of the children, but also it impacted the physical well-being. We see kids with increased weight, with, of course, from lack of exercise, from lack of going out, being socially isolated, also scared to go out. Some children really are very anxious, and all that really affected the families as a whole, the family system as a whole. So children are social beings. They love to interact, especially teenagers. They love their peers with all the stresses and the impact of the stress when they go to school. And this is, I'm a big advocate for kids returning back to school. In-person learning has a great impact. Children is a safe, the schools are a safe place for children, especially with all the measures that schools are doing to protect the children, to protect the staff, and that really, you know, a big advocate for them. And of course, all the pediatricians and the pediatric providers, they support children back to school, where they can have their, some kids depend on schools for their meals, also for the education, and reduces the impact on the family being themselves as teachers for the children. So with that, probably I will, you know, end here and maybe kind of keep it open for more for the questions as we go.
Thank you, Dr. Suleiman Kafidi. We did a similar panel with Shannon Handy back in October, and our district attorney, Summer Steffen, and also pediatricians from Rady Children's Hospital shared the same sentiments that children are doing harm. Harm is being done to them by not being with their peers and in school. We also learned early on that our families need to work. And when we asked our parents if they needed childcare, we had an opportunity to serve them in April of 2020, which was a very scary time to send children back to school with all the unknowns. And Pauline, I'd love for you to reflect on the letter that you read from over a year ago now, your experience being the first parent in the country to bring their child back to an elementary school.
Thank you, David, for the introduction. Good evening, everybody. My name is Pauline Lucatero. I'm the Director of Nursing for Family Health Centers of San Diego, and I'm also a proud mom of Emily and Max Lucatero, who's currently attending Fuerte Elementary at the Cajon Valley School District. So if it's all right with you, David, do you mind if I read the letter? Actually? That'd
be great, please.
You know, it's been a great year of, I don't know about great, but it's been quite a year of reflection, actually. So I'm going to take us all back to the very first day, actually our personal story, you know, being families of Cajon Valley School District. And I know many families and, you know, many families and parents and children may be listening right now. So I'm going to start off with the very first email that I sent Dr. Miyashiro when this whole pandemic shook us all. So it started off with, I know there are not enough ways for us to show our gratitude, but I would like to try. I'll start from the top and share our story. Like the rest of the world, this pandemic shook us all. Both my husband and I happen to be essential workers, an RN and a law enforcement officer. When the schools closed, we had no idea what we were going to do with our 2 kids and ultimately decided that we should just take turns taking some personal time off of work or find ways to change our schedule in between if our employers allowed it. We knew we just had to make it work. And when I received the email for the emergency childcare being offered to essential workers, I completely became emotional and was in disbelief. I never imagined that something like this would happen, especially during such a difficult time for all. Then I received confirmation from the emergency childcare services that I just couldn't help but cry over the phone. She explained everything to me and all the protocols the district has put into place to ensure that the safety of everyone. I was beyond impressed. I can only imagine what it must have taken to get something like this possible and stood up very quickly. But I am certain that it took a special group of people who are true leaders and fighters and believers to make it happen. Both our kids are enjoying their time and the amazing staff there. I will never be able to express enough the deep gratitude we have over this great act of service and humanity. Please extend our gratitude to the amazing team of Cajon Valley District, who is all part of this. I just wanted to reach out to say thank you from the bottom of our hearts. And that's really how I met Dr. Miyashiro. After our email exchange, he reached out further and really wanted to understand from our personal perspectives what this emergency childcare services has brought to our families. And that was definitely, I wrote that very late in the evening. As everybody know, as essential worker, you know, I have an obligation as a medical professional to serve our patients, to serve our community. But of course, I'm also a mom, and I share the same fear and anxiousness that every parent did when this pandemic hit us and the schools closed. I really had no idea what we were going to do. So thank you to your district. Thank you to your leadership. Like I said, I think I couldn't have said it any better in that letter.
Pauline, before we let you go, in addition to having the opportunity to bring your children back, it must have been scary because there were no guidance for schools or for childcare. It was the first time kids were allowed to come back. So what was going through your mind, and what advice do you have for parents now?
So as a mom, there was a lot of things going on in my mind. And, you know, fortunately, I am in the health field, and with I learned a lot from, you know, our own protocols that our organization has put into place. So I sort of kept those in mind and how we kept our patients and our staff here safe at Family Health Centers of San Diego. And I sort of made a comparison and how your district was implementing the same protocols and even more. But not only that, is on top of that, as a parent, I'm not sure if everybody knows, but you know, in the beginning, the kids weren't allowed to bring lunches. Everything was provided for them. The only request was for us to drop them off. And as a mom in the crazy morning trying to get them ready for school, that's a huge relief. I didn't have to prepare lunches, snacks, and just drop them off. And, you know, that was one of the things that probably eased my fears and anxiety. I just had to look at all the positive things that came with it. Was I fearful? Absolutely. So what I did was I trusted everything that we were doing as an organization. I trusted that you implemented the same protocols to ensure the safety of our children and the staff. And as an essential worker, I mentioned I have an obligation. So I was very grateful for the services that were provided for me that allowed me and my husband to work. So there's just a lot of those things going through my mind that I just had to go with it, right? And with that, every single day I would ask actually my kids, and how was it? How was school? So I asked them very detailed questions just to really ensure that those protocols were in place as well. So, and I was very relieved with their answers, and they were very careful. They recited everything to me, and just the whole staff was just really strictly following protocol. So.
Thank you, Pauline. Good to have Shannon back.
Thank you so much, Pauline.
You're welcome.
Yes, I apologize. Apparently, I'm having some technical difficulties. So I apologize that I disappeared for a bit. Aside from hearing Pauline's perspective in your district, but outside your district, but a couple of parents in the Cajon Valley Union District are here with us. They've been waiting patiently. And I know Julie is here joining us. And Julie, you had a question for the experts. What do you want to know as kids are going into summer break and then they'll head back to school in the fall?
Yes, so I just want to tag on to what was said earlier, that I am very grateful to Cajon Valley for, doing what they did to get our kids back to school. And mine were part of the summer school program. So I'm very grateful for that. My question kind of has to do with some of the potential protocols that might be in place in the fall in regards to exposure. Obviously right now, as the doctor said earlier, that the 2 week exposure, the 2 week time off with the exposure, definitely can affect them also of having to be out for 2 weeks. I didn't know if it was going to be possible that although we do have an incubation period of 2 weeks, if there's any time frame in that 2 weeks that they could be, tested earlier, so that if they were negative and had no symptoms, could they go back earlier?
Yeah.
That might need to go to one of the other doctors.
Shall I take that question?
Sure. Go ahead.
Yeah, as Dr. Raymer said earlier, we cannot predict. There is a 2 weeks window where at day 13 the patient will start having symptoms and so on, or the child will start having symptoms and so on, and that's why there's that 2 week period. So now, unless in the future children are, now with the vaccination of children 12 years and above, and if they're vaccinated and so on, this will change. And of course, you'll see the decision tree that it's set for the schools will change based on if the children are vaccinated or not.
Can I add on to that? Is basically the only way to get out of that protocol is to be vaccinated, really. The virus hasn't changed. It's a very different environment than we were in last year, but the virus is still what it is. And so that 14-day period is there for a reason. I think, Julie, what you referred to is if you could test out of that. And there was a protocol developed really for healthcare workers where if you tested at day 5, 6, or 7 and you were negative, you could get back to work. Now that protocol was done because we were needed in the hospital and we were needed as essential workers. If you do that shortcut, you're going to miss some people on day 10, 11, 12, 13, 14. It's estimated about 5 to 10% of people will turn positive 14 days after the exposure. So it's a policy decision that maybe David will have to wrestle with, but that was adapted for healthcare workers to get back to work, knowing that we're going to be wearing masks and all that kind of stuff. And as soon as we develop symptoms, we take tests. But the one way to really get rid of that entire deal is just have everybody vaccinated, and then you wouldn't have to deal with it.
Yep. All right. Thanks, Dr. Amers. Now we do have another parent that's been waiting patiently on here. What's the question you'd like to ask? Molly.
I'm actually not a parent, and my name's not actually Molly. Molly is my daughter-in-law who happens to be a parent in Cajon Valley. My name is Jo Alegria, and I'm
That's what I thought. I have written down Joe, and I saw Molly, and I thought, did I write that down wrong? But yes, Joe.
Yes, that also was my technical difficulty, was trying to change the name in a frantic, but it didn't happen. But I am Joe. My question, I believe, was answered. I logged in a little bit late, but I think I got the tail end of the response, but perhaps it could be reiterated in a different way. In recent news, I've heard that there's various information as to when we will no longer need to wear masks and practice social distancing. And what is the reality, and how will that affect public schools?
I can probably chime in and then maybe turn it over to Christian and Kyle after that. I think what you're seeing, and this is, I think a lot of these questions, you're going to have sort of this, this will apply, this answer will apply. Where we are today and where we were 3 months ago and 6 months ago and 9 months ago is in a very different environment. Part of it is we have more knowledge. You know, we've got more time where we've been seeing this virus do what it's doing. And that knowledge really helps aid us in policy and decisions around safety. And so what you are seeing is the end result of that. You're seeing states lift mask mandates. You're seeing adjustments to rules and businesses and things like that. And California is no different. You're starting to see that happen as well. I do think the recent news that has come out about the reduction in masks, coupled with Gavin Newsom, the governor of California's suggestion that the statewide mask mandate would go away as of mid-June, there's still going to be some guidance on what situations masks will be necessary. And I think as Dr. Raymer said earlier, the immunization piece or the vaccine piece of this is really, really critical. What you're probably likely to see in businesses and potentially other environments, which may, according to the California Public Health Department, translate into schools, is when you look at the number of people that are immunized and you look at how the virus is behaving, the risk goes down with the number of people that are vaccinated or immunized. And so you're going to start seeing policy shift on that. So we're heading in an environment where you're less likely to have masks in certain environments. Does that mean we know enough today to know in the fall we won't need masks in schools? Probably not. But how do we get there? How do we get to an environment where that's less needed? It's really going to be immunization, and I'll turn it over to him.
Yeah, and I would just add that, you know, as David has shown, there are multiple ways to mitigate risk and reduce risk in schools. There's not letting kids come in when they're sick. There's taking temperatures on your way in. There's the plastic sheets between people. There's masks. There's distancing. The most powerful thing now is vaccination that we have. And so it's just going to be kind of a judgment call as to whether we keep all those other things going. As Dr. Gordon said, the most important difference between where we are now and last year is vaccination. We're getting close to 50% of our adult population that's vaccinated. And I think what our future looks like is COVID is not going away because there are people that are refusing to get vaccinated. And there's other countries where they have the worst outbreaks they've ever had right at this very moment. So we will have COVID, and we will have pockets of COVID, really mostly amongst people that are not vaccinated. Now, there are no 11, 10, 9, 8, 7, or 6-year-olds that are vaccinated yet, right? So that's a judgment call as to what other tools do we have to keep these kids from getting COVID, from spreading it, and also potentially giving it to people that are vulnerable. There are people that don't respond to vaccines, people that have cancer, people that have had transplants. There are students in your very school who have had leukemia, okay? And so what do we do? What do we tell that little girl who has no protection against COVID, and who is immunocompromised, that everyone's going to sort of take their masks off? So really difficult judgment call. I would say the momentum that we have right now with the CDC announcement is going to continue as more people are vaccinated and as community case rates continue to go down. Whether that happens before the fall, I think depends a lot on whether we're able to vaccinate younger kids, which is probably going to happen in the next couple of months.
Dr. Ramers, I just want to chime in here. How close do you think we are to getting the younger kids vaccinated? Obviously, 12-year-olds started this week. Do you anticipate the younger kids getting approval at some point this year?
Yeah.
I think we're headed there. It's a little bit more difficult to get the vaccines approved below age 12, and there's a couple of reasons. The first is that the dose is actually different. So for 12-year-olds, the dose that my daughter got today is actually the same dose that my 16-year-old son got, 100 micrograms, and they didn't have to change the vaccine at all. But for younger kids, they have to be more careful and slower, and they have to test lower doses and find out what the right dose is. And the safety record has to be perfect because you're vaccinating healthy young kids that have a very low risk of having problems with COVID. So that's going to take a little bit more time. I know that both Pfizer and Moderna have trials that are ongoing right now, all the way down to 6 months, I believe. I think we're probably going to see results before the fall, but the FDA committee is actually meeting in June to really decide what it's going to take to get approval. So I'd say probably. Kala, did you have something to add?
Yeah, something probably about September we may hear for under 12, and then for younger kids under 2 by the end of the year. This is at least for from Pfizer that we know of. So by September you might hear according to Pfizer. And then the other thing which I wanted also to get to comment on the question about the mask. And would the masks go away? I just wanted to say first that all of us, we hear you, we are with you in the same boat about this the concern and we're tired of masks, all of us, and how our children are, just we have to put the mask anywhere we go and so on. I know it is very hard and it's for everyone, but this is it's a step. We are in much better shape than when we were at the beginning of this pandemic, and gradually as a team, all of us together, I think if we just continue doing all these protective measures and the vaccination for children 12 and above, everyone now, doesn't have to be high risk or not. It's a vaccine that is available for everyone. It's effective, and all that is going to lead us to where we want with no masks. I was just on a meeting, in a town hall meeting at 5 o'clock, actually, through the AAP with the ID experts, and from what I heard is that this no mask doesn't apply in healthcare setting, and it will not apply in transportation setting. This is their expectation, and in regards to the schools, it's still they're going to see how this is going to play because of the concern that Dr. Ramos talked about earlier, which is those children. Some children under 12 years are not vaccinated. That's one. And then all kids under 12 are not vaccinated. But even for those kids who are over 12 years of age who are vaccinated, some studies have shown kids with transplant, organ transplant, even if they're vaccinated, or kids with immune, with some immune medications. So all these children may not build the level of immunity that really we want, that we would expect. So they're still at risk. Or kids with leukemia who just came out post chemotherapy and so on. So to protect everyone, if any of us have a child like that, don't you want that kid to be protected, and also have the benefit of being at school still with other children, but in the same time with everybody practicing safe measures to protect that child and to protect everyone.
On that mask topic, nearly 50% of the questions we got in were related to masks, specifically where will our kids have to wear masks when they return to school in the fall? And I want to ask David about this, because I think people heard that CDC announcement today and they thought, great, we don't have to wear masks. But there's a lot of decision makers, right, David? We were talking about this yesterday. It's not just your district that decides if kids wear masks, correct?
Yes, and we've had, I think, several dozen calls about masks over the last several weeks. And my job is to take a meeting and listen and let the parents talk to me and share their frustration. And then I can explain that Cal OSHA and the California Department of Public Health, it's not a guidance that they're giving us, it's a mandate. And in order to open the schools when we did, how we did, we had to promise that we would follow these rules, not just with the state, but with our employees as well. And so it's really not a choice yet. When it becomes discretionary, I think we'll listen and lean in to all our stakeholders, parents, teachers, community, and make a decision that lands in the middle of how everyone's feeling about the circumstances. But right now, it's not our choice.
Okay, thanks, David. We had some other questions about the safety protocols we see in schools within your district and every district, really, the plastic barriers on the desks, the washing of hands multiple times a day. And some parents want to know, is this a new normal, or will those barriers go away eventually? So I'm not sure who can really answer that question, but chime in if you have a thought on that.
I'd love to hear the medical practitioner's answer to that question, because we were told that the barriers were no longer necessary, that the masking and the distancing were more than adequate. But what is the right response in terms of the different barriers and other additional measures that you're seeing?
I'll jump in there. I think masks actually work a lot better than barriers, to be honest. We now acknowledge that aerosol transmission is a potential way that things can get around barriers. If you're in a room breathing and singing and talking, a barrier is not going to do much good, but a mask actually may. So if I had my choice, one or the other, I would say masks are better than barriers. And the one thing that is probably going away a lot is the surface cleaning, the aggressive, we used to call it hygiene theater, where you just are spraying things and wiping things. That's really not going to be all that necessary, because it looks like you can't get COVID very easily from a surface or from a door handle.
But we still have to wash our hands, especially for the influenza. There is more diseases transmitted, so we need to wash our hands. Just practice hand washing.
Hand washing, unfortunately, will never go away. We did at the hospital level or at the clinic level. That's one of the things they're always looking out for, which is good because it does reduce infection. But for this particular virus and how it's spread, there are other mechanisms to reduce spread that are much more important and valuable. I think the way it makes the most sense to me to think about the barrier versus the mask versus the vaccine versus the hand washing. Some people talk about the UV filters or the HEPA filters in air conditioning systems and things like that. So the way I think about it is, if you have a piece of Swiss cheese and the piece of Swiss cheese has holes in it, and if you look at the beginning of this pathway to the end of the pathway, if the beginning is virus coming in and the end of the pathway is somebody getting infected, what each of those opportunities for I think having an impact to slow the spread, it's just putting another piece of Swiss cheese right in front of the other. And eventually what happens is, if you have enough pieces of Swiss cheese, you can't get through, right? So each of those in and of itself is not a 100% solution necessarily. But when you pair them together and put several of them together in a row, it makes it very difficult for that virus to get through. So for me personally, that was the easiest way to think about it. And so I think what you're seeing with the movement away from these barriers is that the other opportunities that you have to slow the spread of the virus, immunization, masks, social distancing, those are so effective that you really don't need the additional pieces, and that those pieces are much less effective on their own. So, right, what you're looking at really is the social distancing piece, the mask piece, and the vaccine piece. And it's sort of the same thing with the masks for me, because remember at the very beginning they said, do masks really work? And what they teach us in medical school now is evidence-based medicine. So it's, we can say something seems like it would work, but what is the evidence when you do a study, a scientific study, what does it actually show? And so what we learn is that even though viral particles are very, very tiny and you would expect them to pass through a cloth mask, when you couple that with the understanding that those viral particles are tied to respiratory droplets when people are talking, and those droplets are actually bigger than the virus particle, all of a sudden the concept of those particles passing through a mask, if you just put a mask in front of your face and coughed or sneezed versus not having one there, it's pretty apparent that there's more particles if you don't have a covering. And so I imagine all of these different opportunities to stop that spread. But yeah, the plastic boundaries are not as effective, and because the other opportunities we have, such as vaccine and masks, are so much more effective, there's really not a need at this point in time.
So if I may just add, as a parent, we do a little ritual with our kids every drop off, and they can, there's 3 things I say to them every day when I drop them off. Wash your hands, wear your mask properly over your nose, please, and wash your hands.
I think that's one of the greatest lessons that came out of all of this, is that we learned to wash our hands more, something we all should have done before the pandemic, right? I want to switch gears to the vaccine because I've been monitoring some questions on our Facebook page. And Dr. Ramers, this was for you from Hannah Alamio. She says, Dr. Ramers, how can antibodies from a vaccine last longer than the antibodies from actually having it? That's my biggest confusion. So I don't know if you can clarify for her.
Yeah, it's been a little surprising that we've seen, the ideal conditions to develop really good immunity to any pathogen, whether it's a virus or a bacteria, is to not be terribly sick, actually. So when people are sick with COVID, there's a lot of really strange things that are happening to our immune system. It's part of why these kids develop this multi-system inflammatory syndrome. It's part of why adults can go into the ICU and be on a ventilator 15 days after they got COVID. So it's really doing mysterious and strange things to our immune system. And what we've just seen in regular observational studies is that people that have gotten COVID are not as well protected as those that have been vaccinated against COVID. So these vaccines, we keep saying they're incredibly effective. They're way more effective than we ever even thought they would be. Extending immunity at least 9 months now. We have studies of Pfizer out to 9 months and Moderna out to 9 months. And it just actually gives a more durable response than getting the disease itself. The second thing is that if you were infected last year, you probably got the ancestral strain or the version that was in Wuhan. And there's now totally different variants that are circulating around. So we now have this variant called the B.1.1.7 variant from the UK. That's the dominant one. And it looks like prior infection is not going to protect you as well as a vaccine will. We don't know exactly why, but it's absolutely been observed that vaccines protect you more than a natural infection.
And sometimes the natural infection might not produce any antibodies in some of the patients. So not everybody can develop, immunity.
Thank you. And Joe and Julie, if you guys have any other questions based on their responses, feel free to chime in. I have other questions that parents sent in, but I'm not sure if there was anything on what these experts talked about that you'd like to know about. Or maybe, David, I know that you get calls every day from people a lot, and I know that I've wondered with my kids in school is, there's this rule where if you have a cough or a runny nose, which all kids do, you have to, stay home for 10 days or get tested and go through this whole process, which I have been through a number of times this school year. Will those rules get relaxed? And again, this has to do with a decision tree, right? It comes from one organization to another down to the school district. So can you kind of explain how that works?
Sure. We're going to learn a lot more tomorrow when the May revision of the governor's budget comes out, because within his budget are all the new rules and legislations around our COVID response in the next school year. But prior to COVID, we would encourage kids to come to school sick, and we would tell them, we will send your kids home when they have a fever, not the opposite way around, because we're funded by kids coming to school by their attendance. That is now a completely backward way of thinking about things. Kids should stay home when they're sick. And we've also learned that on a temporary basis, kids can learn while they're at home. So I think that policy will change. It's happening all around the country. And interestingly, in the beginning of the panel, Shannon, I think it was Dr. Gordon that mentioned that we have in California the lowest case rate for COVID in the country. We also have the highest percentage of students not going to school in the country. And when Pauline reached out and shared, is there anything we can do to help our parents? We still have 5,000 parents in Cajon Valley that are keeping their kids home, even though we've been fully open all year long. And that's out of fear of the virus. And so I'm hoping that Pauline, you shared the treatments that are newly available, that the fear of dying from COVID has dramatically decreased. And can you explain to our listeners what new things have been done and why it's important to make the decision to come back?
So I'll start off from just a simple conversation I had with my daughter, and I basically posed a question to her in terms of if your best friend was staying home and and couldn't go to school, what if how would you tell their mom, their parents, and sort of convince them to go back to school and how important it is to be back in school because you miss her, you miss playing with her and interacting with her. And her simple response, which I learn a lot from my children and just really listening from their perspective. And her simple response was that, that she feels safe at school. She feels safe because there's staff that ensures that they are following the rules, that other kids are following the rules. They're doing what they're supposed to be doing. For whatever reason, she also mentioned the physical barriers that isn't, that could be an option later down the road. And she mentioned how maybe the physical barriers, the mask and the plastic sheets actually provided her a sort of a sense of security along with that. So that's from my 10-year-old's eyes, right? And really just would tell a mom that, that she feels safe for those reasons. And, the staff are really well trained into reminding everybody when, to keep their distance, to wash their hands. They're still doing all the same, a lot of the protocols that you instilled in the very beginning of this pandemic from when we first learned about it. As far as treatment, there is a COVID treatment that is being offered, like Dr. Ramers mentioned that in the beginning as well. And we're talking about the COVID treatment specifically administered through an IV essentially. And it's a one-time treatment. And it's very, it takes about 30 minutes to infuse, and then we observe for about an hour. So that's really what we're talking about. And I'm going to leave it up to Dr. Ramers to explain all the scientific facts behind it.
Just really quickly, we can take care of people a lot better. So COVID in the very beginning was unknown, completely a black box, didn't understand it at all. And you see the death rates were very high in the beginning because we didn't know how to take care of people. But now we really do. We can treat people early. We can treat people once they're in the hospital. But really, I think more important than that, to make people feel safe of going back in, is just the case rates in the community. And those are tied directly to the rates of vaccination. And as the case rates go down, we're at 4 per 100,000 right now. We want to get to 2. And as vaccination rates go up, we're at about 50% right now. We want to get to 75%. It is going to be very safe, and it's going to be very rare to see COVID in anybody who's not vaccinated.
I just wanted to add that there are a couple of studies actually that supports that being in person at school does not really increase the risk of getting an infection more than what's available in the community. There is a study that has been done in New York public schools, actually more than about 1,594 New York schools that was published newly in May in the Pediatric journal, and another study, it was published earlier in January, and both support that going to school in person is not really the infection rate wasn't really as more than what's available in the community. It was just as the same, and being in person is not really a high risk. Especially measures are done. That's the most important thing. That hand washing and and distancing, that all supports. I heard David also from your children have been at school from last April till now, and how many infections you had?
0 to 0 student spread.
Here we go.
Yeah, I think what I would add to that is that, we didn't get here by chance. The case rate being the lowest in the continental United States in the state of California is not by chance. I think, it's the measured response by the leadership in the state, the California Department of Public Health, and the fact that they've allowed us to move forward with educating in person, and our awareness that, educating online is a value in periods of time, but overall doesn't substitute for in-person learning. We have the lowest case rate in the country because of the measures that have been taken, and we have been given guidance that it is safe to open up and safe to come to school with these measures, and we would encourage people to do so, absolutely.
If I might add, Shannon, I am very impressed with David as our superintendent for Cajon Valley. He's really demonstrated a strong amount of leadership. And I know that there's a lot of discussion about the medical importance of what we're doing. But the one component that I think we do need to touch on is the fact that David has the ability to really understand and to lean in to not only his staff, but to us as his board members, how he can communicate certain things to our community. Because if you can only imagine, and I'm sure all of you do know, our community, our school, everyone was at an upheaval where our emotions were very high. And that was a very difficult time. Even David and I had our moments where it was very difficult. But the important part of it is that he has been able to invest into our students, in our community, in our teachers, in our staff to help them understand that we're here to help. We want the best for our students. And the result of that really accumulated into David really helping to lead the nation in understanding how to safely open schools nationwide. So I applaud our superintendent for all that he's done. But the important part of it is that he has been able to invest.
Yeah. I wanted to add one.
Understand.
I wanted to add one more thing is that, as much as we want to get kids back to school, we want also to get kids back into their physicians' offices. We want children to come back. We want them to get checked. We want to work with the parents on working on whatever their concerns. And we want kids to be vaccinated to other diseases for prevention other than just COVID. There is whooping cough, there's meningitis, there's the papilloma, the HPV. So we really need, and of course, younger children, they need to get their measles because we want to also prevent outbreaks to other diseases, not just COVID. So come over. We'd love to see all the children. We'd love to take care of you and for all the families and support you in each and every way.
I wanted to ask you, David, I know that it's going to be different for districts countywide because we obviously have dozens of districts here in San Diego, but there really are still families that just simply don't know if they will be comfortable sending their kids back to school in the fall. So what are their options? Will there still be a virtual option? Are you working on with these families on a case-by-case basis, or how will that work?
That's a great question. So we're anticipating that tomorrow with the governor's budget that he's going to eliminate distance learning as of June 30th, which will mean that districts can offer independent study in a virtual school. Fortunately for us, we've had that option prior to the pandemic. So we will continue to provide an option for virtual learning for our families. It will not be distance learning, but it will be actually virtual school with a separate teacher from a virtual academy, which will be a Cajon Valley employee. So that'll still be available for students.
Okay, so a lot will come out of this budget tomorrow, you mentioned, from the governor. So we'll know a lot more. I mean, the reality is, and I know you doctors get these same questions just like David. People want all the answers right now. And with the new virus, you guys are getting all these answers day by day, right? And it's the same thing with the school regulations and the rules. And I'm sure you've had to explain that to a lot of families over the course of the last year.
It's stressful. It's hard to be patient. I think, the accolades that were given to David, I think it's, we go through that in healthcare too. I mean, we had medical providers that were stressed. They were worried about their children in schools. They were worried about their safety at work. And so whether it's, being a parent, it's the safety of a kid at school, it's the safety of a medical provider at work. We all went through the stress of the pandemic and quite frankly continue to do so. I think it speaks to our resilience to be able to try to take a step back and understand what's going on, and then to try to be patient with the information as it comes out. We're far more empowered today than we were when this started.
Well, I really want to thank all of you for your expertise. I wish we could stay longer, but I know we had a set end time at 8. David, did you have any final thoughts?
I do want to say one last thing. I want to thank our healthcare professionals here on the panel, not just for being on the panel tonight, but for not stopping service to our community at the beginning and throughout the pandemic. And when we met Pauline and Saul Lucatero, and they said that if we don't have school, we can't go to work, our employees showed up as essential workers in person to open schools so that our community can run and our economy can thrive. And I just want to thank the employees of the Coen Valley School District for showing up in person as essential workers for your community from the beginning.
Thank you, David. And again, thank you to our panel. If anyone chimed in or tuned in late, we will have this on our CBS8 Facebook page, on our YouTube page, so you can still rewatch this panel. And of course, this is an ongoing discussion. I'm sure this isn't the last time we will be meeting. So thank you guys again and have a great night.
Thank you. Have a good night.
Good night.